Wounded Warriors Canada, it was set up as a foundation at that time, an organization that was set up to take in the goodwill of Canadians, those that are contributing to the situation affecting ill and injured military members, veterans, and families, and then put those funds to really good, impactful work. And our first kind of major foray into investment into the sector, the military veteran sector. So that goes way back to 2013. We sat down and devised a 10-year, $400,000 Wounded Warriors Canada doctoral scholarship that would invest $40,000 a year into those that wanted to study into the situation affecting military and veterans.
For sure, I remember the exact moment and time when I got the notification that I received the award, and it was incredibly meaningful to me. It meant a lot. This type of research, this type of work that you do, it's not just a professional part of your life. It really becomes, like, I talk about it as sort of being like it's your firstborn child because of how much work and energy you put into the work that you do. And you really have to be motivated to believe in what you're doing, and to get a scholarship, like the only scholarship at the time in Canada for military veteran research was the Wounded Warriors Canada Scholarship. It was really meaningful at the time.
Winning an award like Wounded Warriors really helped, I think, to improve my confidence and also, self-efficacy.
What this initial research has been able to do is give me a platform to share this information. So because of that platform, the research is out there. I've been able to connect with other organizations that are jumping on board to say, hey, that's really important for healthcare providers to know what is unique about this population and how we can best support them. So it's been a great opportunity. It's given me a unique space to be in within Canada. And, because of that, I've been, invited to meet with colleagues around the world. So, I'm very grateful for that.
Primarily, when you think about receiving this scholarship, when I was engaged in the research, the scholarship meant that it sort of gave legitimacy to the research.
I was very new to the community. I didn't have a lot of exposure to military research, so that first forum was just incredible, because I was like, the way there's so many different people focusing on the same community, you can just see all the puzzle pieces coming together. So I didn't know a lot about Wounded Warriors. Now that I've been a part of them, I see them and people come up to me and they're like, I saw this ad, or I saw this pamphlet, or they were outside, people were fundraising outside the Safeway. Especially when you're a student, the money is really life-changing in terms of allowing you to be able to just focus on your work. And then when I started meeting the individuals from Wounded Warriors and connecting with the previous scholarship winner, it just really felt like family atmosphere and really supportive.
The financial aspect of the award was really, really impactful that way, because I was able to leave my part-time job and focus full-time on this work without my attention being divided.
I was, extremely honored to have been on stage with General Romeo Dallaire, who was part of the conference that year and was able to be on stage and present the award to me as part of his work with the Wounded Warriors Canada. So that was, a huge, huge, huge honor. So it really gave me the space to kind of focus on the research that I was passionate about, build important connections and relationships with researchers in military mental health across the country and internationally as well.
The scholarship really gives you a stage to speak from, because it really distinguishes the research that you've done, and it allows you to to really move from just accumulating the knowledge to actually moving to praxis, or moving into how is this relevant? How does this make an impact on the world? Where does this actually affect the people?
We know more now, or as much as we've ever known before, with respect, like scientifically, from a data perspective, from an evidence perspective, than we've ever known to look at the situation, look at the sector, and then identify ways to treat it and support it and bring help into it. So I can't stress enough how significant that is.
I was doing my PhD. I had this strong desire to focus on a topic. It wouldn't have happened if I didn't receive the scholarship.
How do you actually make it so that it benefits the people who were so generous with their stories, who told you the stories that they would rather never speak about, but they actually trusted you enough?
So I was able to use the research, the findings, the themes that came out of that into help support the creation of the Warrior Kids program. And, really that was something that helped in developing the philosophy and, the foundation of the Warrior Kids program that now currently runs with Wounded Warriors Canada. And really, there were some key pieces that not only just from the findings, but I think from the experience of doing the research that we still carry forward through with the Warrior Kids program.
My project consisted of 3 studies, all focused around understanding what constitutes quality participation for military veterans with a physical disability in sport. But what was also exciting is that eventually got merged with the work that was being done with civilians with physical disabilities on quality participation, and has now served to develop what's now called the Quality Parasport Participation Framework.
The work that I did during my PhD was around developing an understanding of what makes military and veteran families unique when they're accessing healthcare services. You have these families that are putting their lives on the line, that are putting it all out for our nation, and this is a small role that I can take to support that, just to better understand, come up with some strategies, some ideas, have an understanding of how to support the work that they're doing for our country.
We know that moral injury is something that resonates with people. We know it's something that people experience that really impacts their mental health. But what is the best way for us as clinicians to use that in the therapy room with people? And what is the best way for us to communicate about that across professionals and with systems that might be providing benefits and services to veterans?
My research was, here we've got a group of men, these kind of very seasoned veterans, experienced, tough as nails, hard to work with in some ways, because they'll tell you exactly how you're doing and what they think of you. So that was the question: how do we reach this particular population that as a mental health profession, as a community of mental health professionals, we're actually failing to reach. We're failing to be relevant enough to attract and able to show, there's answers here. There's practical things that you can do. There are tactics that you can use, strategies that can help you in your day-to-day life.
I think CIMVR has been really innovative in this space, in that it has positioned itself really well in bringing people together. So, I would have not been connected with other, researchers or other organizations if it wasn't for this network that CIMVR has created, and really highlighted the importance and the uniqueness of military members and veterans and their families.
All of the work of CIMVR, Wounded Warriors, and this scholarship is part of that sort of leaning in for some deep listening to the people who have given so much to Canada, and just a part of how we can respond to that need, and respond to that obligation that we have to take care, and not just kind of let them come home, but let them fully come home.
When you start from a position of knowledge and science and data and need, things can move much quicker on the change, impact, interventional side than we had certainly had witnessed. I think we're just, if you look ahead to the next 10 years and from where we were the previous, that's something that stands out to me, is how much quicker we can operationalize impactful things.